Love it. All right, let's go ahead and move on to the CDC. This is a really interesting story here from the New York Times, but it's very important. I also think it's funny the way that they framed it. They're like, oh, this just continues to happen, fueling questions. It's like, no, it should fuel questions. That's the whole point. Let's put it up there then on the screen, which is that the CDC is not publishing large portions of the COVID data that it collects. Now, specifically, for more than a year, the CDC has collected data on hospitalization for COVID in the US and broken it down by age, race, and vaccination status. But it has not made most of the information public. In fact, when the CDC did publish the first significant data set just 2 weeks ago, it left out numbers for, quote, a huge portion of the population, which is 18 to 49-year-olds. In other words, what they did is they basically rigged the data to say, hey, boosters work really well for adults who are younger than 65, but then they leave out all of the ability to actually
18 to 49-year-olds
parse that.
out.
So hold on a second. You left out the vast majority of the US population in order to try and use and sell the public on booster efficacy? I'm not a conspiracy theorist. I think if you're old and if you have comorbidities, you should probably get a booster based upon what I can tell. But it's very clear here that they had data which contravened their public narrative, and so they're just not releasing it. And you said this too at the beginning. This is the stuff of people's dreams who believe in vast conspiracy theories. And I mean, how else can you describe it? You have the government agency here, which does have data on all of this. You know, for a long time we had the excuse of, oh, state data, it's hard to compile. They basically got it down. They have it all in terms of age and race and vaccination status and everything, and then they just simply refuse to release it. And actually, to their credit, while I believe Israel has done some absolutely bonkers stuff with some of its mandates, the forced shots, etc., they still do release their actual public health data, which gives us the insight to look at what's actually working and what's not.
Well, and that's what's crazy is if you've been wondering, like, why have they been so dependent on Israel's
this is why.
data? For especially boosters was a big, we kept sorting through the Israeli data to see the efficacy of boosters. It's because our own supposedly, number one in the world health agency is hiding. They have the data, but they're not sharing it with anybody. And it's not just on boosters. So they wouldn't release the data. They left out numbers for 18 to 49-year-olds with regards to efficacy of the booster. They also had come under fire for not tracking so-called breakthrough infections in vaccinated Americans, focusing only on individuals who became ill enough to be hospitalized or die, because they didn't apparently, I mean, this is all you have to read between the lines, but apparently they didn't want people to know how common breakthrough infections were, even though, again, they had that data and didn't share it. Apparently, the American Academy of Pediatrics have been asking for the proportion of children hospitalized for COVID that have other medical conditions, so you can understand, okay, what's the risk for a healthy, child versus what's the risk for a child who has other comorbidities. Wouldn't provide that data. The Pediatrics Academy also has repeatedly asked the CDC for an estimate on the contagiousness of a person infected with COVID 5 days after symptoms began. And one of the folks with the Academy finally got the answer from an article in the New York Times versus from the CDC. And so, their justification here, and I just think this is too perfect, and this has been the problem with these public health agencies and also with Dr. Fauci from the beginning. It says the agency has been reluctant to make those figures public because they might be misinterpreted as the vaccines being ineffective. It's not your job to psychoanalyze the public.
Yes.
It's not your job to be the politician spinning the data or hiding the ball. It is just your job to disseminate the information and then let us all handle it. I mean, and you've done so much damage in terms of now you don't think this is going to fuel people's worst fears and anyone who's, who is skeptical of the vaccine. I mean, this is a dream for them to be able to say.
Look, Krystal, if there is another pandemic, let's say the in terms of its mortality rate is 10 times higher, I'm not going to believe these people for a long time. I don't think I'm the only person. I mean, I would literally have to know and see people falling dead in front of my face to be like, all right, okay, maybe I'll hear them out a little bit. That's not how I felt 2 years ago.
This is exactly the same as at the beginning of the pandemic when Fauci says, masks don't work.
No, I agree.
And it's the same. And after the fact, I mean, he even admits it because he thinks he's doing the right thing. He admits that, no, we wanted to save the masks for people who are on the front lines. It's not your job to lie and manipulate people or hide the ball here. It's your job to get out the data. And if the public can't handle that or, deals with it in a bad way, then we have to address that down the line. But this is absolutely abysmal. I mean, I think what we can say is that we haven't only been dependent on the CDC for data. We have data from health agencies and from research around the world to show us the efficacy of the vaccines, to show us the death rate for different subpopulations, to show us how much more at risk the elderly are. But the fact that our own public health agency that is supposed to be, the premier, the best in the world, has been sitting on this data that could have helped us tailor our response, that could have helped us understand for ourselves in our own lives what risks to take, what decisions to make, what to do with regards to our kids. I mean, this is an absolute bombshell story, and it's despicable that they've been hiding this data.
Yeah, I mean, $1 billion they've been given to modernize its systems in order to track data. But I don't know if you will remember Dr. Deborah Birx, who ended up working for Donald Trump and then eventually left the administration. She put in her memoir that whenever they approached the CDC, they're like, hey, here we have all this money. You guys can update your tracking stuff. They're like, no, we're good. We don't need it. Yeah, I outright rejected it.
Wow.
At the time. It basically had to be forced upon them by Congress. I think there's a couple of things happening here. The immense amount of hubris to think that, oh, well, we just know better. And that's it, which is we can hide the data and we can spin it whichever we want. In a free and open society, and especially in the age of the internet, they can lie to you, but we have the data. We can go on. It doesn't take a genius to read Hebrew. Like, you can just go on and be like, okay, well, human beings are generally the same, so here's how it's working over there. Same thing in New Zealand or South Africa, wherever. Information travels fast, especially in the age of online. And when we see that, they seem to think that they can just continue to manipulate the public and that we're not going to find out that they're lying, and then they end up admitting that they are. Everybody knows that it's very clear that the original promises on vaccination, on masks, and so much more did not turn out to be true. And here's the thing. I don't begrudge. I think it was a noble effort to try to do it. But soon it became a sinister effort to try and force everybody in order to take up something which is clearly not working the way that they promised to. That doesn't mean that there weren't legitimate benefits. And look, I think a central tenet here of our show is trust people to make a decision for themselves. We can explain it to you. Be like, look, it's going to dramatically reduce your risk of hospitalization and death. That seems pretty worth it to me. Some of the promises on transmission and all that didn't end up working out to be true. Same with the masks. Masks, wearing in June of 2020 when you didn't know that much compared to August of 2020, substantially different. Yeah. Same on school closures. I'm willing to even give them the benefit of the doubt in the beginning. But around October, we knew almost everything we needed to know.
Yeah.
And it's now
even by the
year and a half later.
It was, time to reopen the schools in the fall.
Oh, yeah.
I think we had enough data to know. But it really does go to a central theme of this show that you were just alluding to. I mean, this is as anti-populist as it gets.
Oh, yeah, 100%.
We elites and experts know better. And so don't you worry about it. Don't ask any questions. Just accept that you're going to get from on high what our decision is for how this is all going to go. We're going to control the information. We're going to decide what we think the population can handle, what sort of information they're capable of sort of parsing through and dealing with, rather than having a real democracy, which is where, you have the information available, where there's transparency, and where there's a public debate, which, yes, sometimes is messy, sometimes is uncomfortable, sometimes people who are wrong have a say in it, right? But that's what a democracy is all about. And, the greatest principle of our country at its greatest ideal is sort of that populist belief that people are capable of self-government, that they're capable of evaluating that information, engaging in public debate and thinking through whether it's, response to a pandemic or whether it's to monetary policy or any of the other weighty issues that we have to think about in terms of how we move our country forward. You can't outsource it to experts as much as they would love to claim the power and say, hey, we're just crunching the numbers here, and pretend like they're not making their own value judgments, that they're just doing the calculations and working through the spreadsheets and doing the, equations to come up with what the correct answer is. There's no substitute for a public debate that involves the values and the priorities of the population, which are going to be, there's going to be tension. It's going to be messy. Sometimes people you don't like are going to win. But ultimately, that's the thing that I have faith in, and that I think we have faith in here.
I have a lot more faith in that than in the CDC.
Than in these people, Lord knows.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.